Families providing 24-hour care to relatives ask the state to walk a day in their shoes before making changes to Medicaid. Good evening, I'm Julie Cornell.
I'm Bill Shammer. Nebraska Health and Human Services recently proposed changes to the aged and disabled waiver. KETV News Watch 7's Madison Perales went to a family's home to learn how these changes might impact a 24-hour caregiving family.
It's a story you're seeing only on 7.
DHHS is proposing a 40-hour time cap per family per week for Nebraska families across the board, but some people require 24-hour care. One Papillion family tells me it would be detrimental to their son's care who has Duchenne muscular dystrophy. This is the Castor family. Their 30-year-old son, Derek Castor, has Duchenne muscular dystrophy.
If that trach falls out of his throat, he has 4 minutes for somebody to put that back in, or he's gone. He's dead.
Tammy Castor and her husband Darren take care of Derek 24 hours a day.
I've been on a date in how long?
Yeah, I can't even tell you the last time we've done anything, just us.
If the proposed waiver changes went into effect, the money they get from the waiver would go from around $60,000 a year to
$31,200 a year. I would probably find a job that's overnight.
To avoid putting him in institutionalized care.
He wouldn't last 6 months.
I have to be moved every once in a while in my chair.
Derek was officially diagnosed when he was 6 years old.
I was tripping and falling a lot, and so that's how we kind of knew something was off.
The disorder eats at the body's muscles. In recent years, he became fully dependent on his parents.
I got really sick in 2020 with sepsis, and that's how I ended up on the ventilator.
Requiring 24-hour care, assistance his parents don't want to hand over to a stranger.
Talk to us, Governor. Talk to us, senators, because I guarantee you we have ideas that can help you cut this budget.
When KETV asked the governor's office why the state is proposing these cuts, spokeswoman Laura Strimple says costs have skyrocketed and proposed changes that ensures the level of care matches the needs of the individuals being served, and also establishes guardrails like the time caps on hours worked.
They're not looking at the bigger picture. They're just looking at dollar signs, and I don't want to be labeled as a dollar sign.
DHHS is still reviewing the public commentary on the proposed changes and says in a statement to KETV the waiver could change based on the results of the public comment review. We'll continue following this to see which way the department lands on the proposal. Back to you.
A lot of eager eyes to see which way this goes, Madison. Thank you.